Hello, veterinary friends. Welcome to the Veterinary Life Coach Podcast. Today, I have a wonderful guest for you. Her name is Dr. Kate Elden. She is a DVM, veterinary leader and advocate for the evolving future of veterinary medicine. Growing up with a brother with autism and neurodevelopment, she witnessed firsthand the profound impact of a service dog on her family, instilling a lifelong belief in the power of the human-animal bond. After studying pre-med and riding horses professionally in Spain, which is really cool, you got to tell me about that, she pursued veterinary medicine at UC Davis and began her career in equine practice. A career-altering injury prompted her transition to small animal medicine in San Diego, where she rose from associate to lead veterinarian, helped open a new hospital during the COVID-19 pandemic, and became deeply involved in veterinary telemedicine. She later served as medical director at the hospital she had visited as a child. Today, Dr. Elden is Chief Medical Officer at Dutch, where her work is driven equally by her love for animals and her commitment to veterinarians, supporting well-being, expanding access to care, and developing the next generation of veterinary leaders. Welcome to the podcast, Kate.
No, thank you so much, Julie. Thank you. I appreciate that introduction. And I also just want to call out, I appreciate you recording a podcast so regularly over a long period of time. I know what it takes to keep these things going, and I think what you're doing is awesome. So thanks for having me on.
Yeah, I really love it because I get to meet so many different people and mostly veterinarians. That's why I started because I love veterinarians, but it's just fun for me. So yeah, it's a little bit of work, but I get to meet people like you and hear your story. So it's fun for me. So that leads me to my first question, which is always to tell me your veterinary story. So if you could fill in some of the blanks, the things that I already introduced, I would love that. I love the details.
Yeah, definitely. So my veterinary story, I would have to say, starts with, like you said, I grew up with a brother who had autism and a neurodevelopmental disorder. And I realized early on that the human animal bond was so important for pets, important for human health. My brother, I'll do a long story short, he used to wake up in the middle of the night and wake all of us up in the house and raid the fridge. And then as soon as we got this beautiful golden retriever, canine companion for independence, he started sleeping through the night.
Nice.
Yeah, I mean, it was life changing. It was life changing for our family.
Sure.
And when I asked him why he started sleeping through the night, he said, Jamie, which is the name of our dog, Jamie protects me from my nightmares. And I think that just changed the rest of my life because I realized, oh my gosh, we didn't know he had nightmares. This dog just being around him comforted him. There's so much there for nonverbal communication. How just that animal being with him, supporting him, made such a difference to him and our whole family. And our sleep and energy and all those things. So
Everybody got more sleep.
everybody got more sleep. Such a good thing. Jamie's an angel. I actually wasn't one of the kids that said, I want to be a veterinarian from my whole life. But that moment like solidified my love for animals and wanting to have them in my life.
Nice.
And then I went to college thinking I wanted to go into human medical school and cure cancer. My mom had breast cancer growing up, and I was like, oh, I'm going to do a PhD, MD program, such a type A. And then the more I started working in human hospitals, the more I realized, like, I think I'm going to do something else. And I applied to veterinary school. And
On a whim. It was
on
just
a whim,
like a second choice. I love that.
and I was like, you know what? I'm going to go take this job riding horses in Spain, and I'll see what happens. And then I got back, or I came back when I got that email. All of us veterinarians, you open that email and it's like,
Email, yeah.
Yeah, that email is, I can still feel the adrenaline rush of like, you've been accepted to have an interview. And so I came back and went to vet school at UC Davis. I just loved veterinary school. I had the greatest time. Some of my best friends I met in vet school. And I was on track to be a horse vet forever. uh, president of the Equine Medicine Club.
Nice.
And just, yeah, if you'd say, Kate, you're going to be working with dogs and cats later in life, if you'd said that to me when I was in vet school, I'd have been like, you're crazy. But sure enough, I practiced in Colorado for a bit at Littleton Equine Medical Center's a phenomenal facility, and I got amazing mentorship there. And I think that was mentorship that applied across not just working with horses, but just how to be a veterinarian, how to talk with clients and communicate, how to be ethical, how to triage. Every every emergency horse call kind of starts with telemedicine before you
Yeah,
drive like an hour out to a
that's
farm.
true. It does, doesn't it?
Yeah. So I think before, we just called it being on call. We didn't put that name to it, but I learned
Right.
so much. Grateful for that time in Colorado. And then I came back to California and got my dream job, working at a practice, Conejo Valley Equine, driving around the hills of Malibu, taking care of horses of the rich and famous.
Beautiful.
It was so fun. I had my own technician and my own x-ray machine and ultrasound, seeing beautiful horses. And then I got kicked. I got kicked pretty bad, you know,
No.
and it was in a time in my life where things were going well. Like I had landed my dream job, but then life kind of hit me in the face and I had to step back and think about, okay, what am I going to do next? And I got pretty lucky. I reconnected with my now husband, who amazingly had been hit by a car and was also in a place where life was going great. And then life threw him a curveball, and the both of us, it's like when the going gets tough, the tough get going. We saw that in each other.
Yeah,
And I was like, you know what? I think I want to marry this man and have a family, and I'm going to do small animal medicine. And I never looked back.
that's awesome. So
Yeah.
he kind of inspired you to pick it up and go and do something different.
Yeah, both of us, I've known my husband since high school, and both of us just had this kind of attitude. It's like, well, when, yeah, life gives you a kick in the butt, what do you do? Do you wallow in your sorrows, or do you pick yourself up and by your bootstraps and make the most of something? And that was definitely where my head was at. And that drew me. I was like, that drew me to small animal medicine. I was like, you know what? I could do something. I could do something different if I wanted to. It takes a lot of courage to do that.
Sure.
Um, and we saw those same qualities in each other. And I started out doing rehab and acupuncture in dogs and cats. Treating a dog like a small horse
Like a
felt very
horse.
natural.
Yeah. Yeah, of
Yeah,
course. That makes sense.
yeah. And then I branched out into relief work. I worked in private practices, and then I worked in some corporate groups and the large corporate groups. And then I had just opened this new practice with a former mentor of mine in San Diego, and COVID hit, and we closed our doors, just like most all of the veterinary practices in our area. And I was sitting at home, and I was like, you know what? What am I going to do here? So I started doing some telemedicine, and I got hooked. It was in that moment, like I realized, oh my gosh, it's very easy to help pet parents sometimes. Their questions often are simple, and they want to know, do I need to take my pet into the ER? I felt it just was so rewarding to be able to help people with their quick questions, and they never had to leave their home. And I think from that moment I was hooked, and I went back in person practicing, and continued to do some telemedicine. But I do think that it's oftentimes difficult to stop your busy day of seeing appointments in person and to do a telemedicine appointment and then come back and do some more in person, then do telemedicine. So um, after that practice, I was recruited to work as the medical director at the practice where I grew up bringing that same dog Jamie to when I was a
Oh,
kid.
wow. That's awesome.
Yeah, so I couldn't say no to that. I worked as a medical director there, and then moved on to starting and operating a telemedicine layer onto practices in San Diego, because I saw the need for being able to offer that for pet parents. Some things we can treat from home, And it's really nice to be able to do that for pet parents. So that's my
Sure.
veterinary story.
Yeah, well, that's an amazing story. And I think COVID-19 did kind of start the whole telemedicine discussion
I
because
think
if you
so.
were working then, and I was working full time in my practice, we had to do something. We were still going
Yeah.
in and we were having people, drive into the parking lot and bring their pet into the foyer and handing them off and doing all those kind of things, which puts you on the phone anyway, because you could only
Hmm.
communicate after you examined the pet to the phone. And then also there was a lot of elderly or older people that couldn't leave their homes during COVID because they were terrified that we had to, work with them over the internet or over the phone. And it made for some really funny calls, like I had old people that
Hmm.
didn't know how to use FaceTime and I'd be seeing up their nostril and they're trying to show me the dog and it was really entertaining. But I agree that it kind of started this whole idea that we didn't always have to see the pets in the hospital.
Yeah, and like that, and that's part of my story doesn't end at that hospital. Now I am at Dutch,
Right.
and part of what brought me here is Dutch as a platform. We've got this figured out, the infrastructure for telemedicine to make it easy for
Make it
veterinarians
work.
and for pet parents. Um, and I think one thing to call out is so we all got this awareness of telemedicine and put a name to it during COVID. I sure did.
Sure.
Like, it wasn't, we were joking before we went live, we were joking about how, like, every equine emergency call starts as a telemedicine
Sure,
appointment.
it does. Yeah.
Yeah, I didn't call it that. But telemedicine, if you really boil it down, in telehealth is as old as dirt. The definition of telehealth is anytime you use electronic communication to communicate with a pet parent about the health of that pet.
Sure.
And what we've done is created different and better infrastructures for how we do telemedicine, like at Dutch. It's pretty easy. I think operationally it's kind of difficult. Like I don't know if you felt that way at your practice. Sometimes at brick and mortar practices, it was more difficult to do telemedicine calls.
Well, I think in a way because it was a one-off and not the whole job, right? Like
Right.
it was like you got to call this person and talk to them and then figure out how to treat their pet, or can you just prescribe medication that they can come pick up, or can you have them bring a test in? If it was an ear infection, it was like, well, can you get a Q-tip and get some gunk out of there and then drop it off at the hospital? Like it was that kind of conversation,
Yeah.
because they were our clients, right, in our local area. But I do think that, having that, just kind of perfecting the whole system. And like you said, we've always done telemedicine. We just didn't call it that.
Yeah. And I do the same thing now with my clients too, because we ship urine test kits and fecal kits to do some diagnostics through telemedicine. And I'll explain to owners, you're going to get something that looks like a Q-tip in the mail,
Right.
and you want to get a sample from here.
Yeah.
Uh, yeah. So, yeah, I hear you. I can relate to that. I think, like, you know, um, I think looking at the business of veterinary medicine and where we are now and where we're going is important too. And just because we've done something one way for so long doesn't mean that that's the way we should do it forever.
Right.
Especially if, right, there's that PetSmart Charities report that came out that shows that 52% of pets in the US are getting no care due to cost or
That's alarming.
access. Yeah, that's
Yeah.
over half of pets in the US are just getting
Right.
no care because it's too expensive or too hard to get to. So, that forces the reflection of, like, well, are we doing something wrong? At least that's what I think about. And I wrote an op-ed about it. Um,
Yeah. Tell me about that op-ed. It was in DVM 360, right?
Yeah, it was in
Yeah.
DVM 360. It felt like a real personal one, actually. So, it feels like you put yourself out there when you write something and publish something personal.
You're waiting
But
for the fallout, right?
exactly, I'm like, I hope people like it. I hope they agree with me.
Right.
And my thought is, and this goes back to my childhood and the human animal bond, is that this idea that pet ownership and pet care that comes with pet ownership shouldn't be something that's just reserved for the wealthy. And with the rising costs of care, that's the direction that we're moving.
Hmm.
And in that PetSmart Charities report, in that Gallup survey, they asked questions to, it was 933 practicing veterinarians, so almost 1,000 veterinarians. They asked a bunch of questions to, and one of the questions was, which view came closer to your own? Is it the responsibility of the veterinary industry to make veterinary care affordable for pet owners? Or people should not own pets if they cannot afford veterinary care at current market rates? So vets had to pick one that was closer to their own. It's the responsibility of the vet industry to make care more affordable, or people shouldn't own pets. And I was surprised by the responses. 63% of veterinarians chose that people shouldn't own pets if they can't afford care. Only 37 chose the first. And I was just, after that report, I was just heartbroken. I don't know about you, like in your first impression from hearing that, but I'm just like, wow, is that really where we're at? And I try to stay curious, because I love veterinarians. I've never met
Right.
a veterinarian I didn't like. Like, we are all in this because we care about pets. And
Right.
then to
But
just say, yeah.
I think it's kind of understandable, sorry to interrupt you, that they might say that because of the fact that they're in that situation where they're trying to get paid, they're trying to do a good job. They have pressure because they have, $200,000, $300,000 student loans. And so
Yeah.
there is, I could see why they would lean that way just because of the pressures of our profession and really life in general, right? Like everybody is struggling to afford something. And
Mm-hmm.
so it surprises me because we're all so kind and loving people. But I also get where that 63% are coming from because there's so much pressure on them to make money, earn money, have money.
Yeah.
And the people that can't afford our services are kind of a drag on their profession and their
Yeah.
lifestyle in a lot of ways. So I kind of get both sides.
Yeah, 100%. And so, like, I sat with that number and I thought about it, and I was like, you know what? Veterinary care is really expensive, and a lot of pet parents can't afford it. And oftentimes, the veterinarian is the one, maybe the only one, who's having to communicate that burden of cost,
Sure.
right? Like, you're the one having the conversation. We're the ones having the conversation in front of the pet parents saying, this is your bill. And it's heartbreaking when that ends there.
And
And
they
that's
just say, I can't afford that.
yeah, and we always talk about the burden of the cost of care on pet parents, but it's a burden on the veterinarians too.
Yep.
Especially as more and more of our profession gets like condensed into this larger corporate ownership. Like, the veterinarians don't have control over the pricing.
No.
They're relaying the information and they're doing their best. And so, in that question, if you go back to it, you're asking veterinarians, is it the responsibility of the veterinary industry? I think for vets, that probably feels like the weight of the world on our shoulders. Like, is it my responsibility to make pet care more affordable?
Right.
That kind of defensiveness is probably like, I can, I see how that, I see how they would choose that. No, people should own pets, even though it kind of breaks my heart because it's this. I think that is a less understood part of the toll of the cost of veterinary care, is that
Right.
vets are struggling with this too, not just the pet parents.
Sure.
And I don't think that production incentive compensation helps that situation at all. And I don't pretend that I can solve all the world's problems, because veterinary businesses have to be able to make money, and and I know that, but I do think that we could start getting creative, from the inside out, from veterinarians, the ones that are doing the work, to
Right.
try to get together and have these hard conversations and talk about what would better look like. Maybe a salary with ownership stake. So
Sure.
where you're incentivized to use your diagnostic acumen instead of making a bill higher.
Right.
Because like I talk to my friends that are in human medicine and dentistry and how we pay veterinarians on production, a percentage of pharmacy sales, that would be completely illegal in
Sure.
their.
Because it's
So
a
there,
conflict of interest then. Yeah.
and so
Right.
why is it, and I just think that when we're incentivizing veterinarians that way, you're putting them at odds with what pet parents want, which is usually to keep the bill down and to just take good care of their pet. And over time, that friction, no matter how good that veterinarian is, like that friction it takes a toll. And I think we should have compassion for veterinarians for that. And I don't think just like putting our head in the sand is the way to go about it. So that's been on my mind. That's what that op-ed is about. So
So how do you see telemedicine helping with that particular issue? I mean, you've kind of already alluded to it, but how do you see that being like a stepping stone into a better model for vet med?
yeah, that's a good question. I mean, I got into veterinary medicine because it was fun for me and rewarding, and I like it. And I stay because of this opportunity for a better future for veterinary medicine, or just kind of pushing us to change our business models so that we can offer care in the way pet parents want it and can access it. And so, yes, I think kind of the future that I see for vet med is this world where pet parents have an in-person vet. They've got a relationship with a veterinarian in person, and they have a veterinarian that they see through telemedicine so that they can get care both ways. So telemedicine allows pet parents to be able to access care from wherever they are. They can hop on a telemedicine appointment from their phone, an iPad, a computer, and it's much more affordable. A membership at Dutch is just about $11 a month, and so for the cost for a whole year is the cost of one exam fee.
Sure.
And they get access as a Dutch member. You get access to a veterinarian. You can call that vet, have as many video visits as you want throughout that whole year, and you get up to 5 pets on your membership. So it'll talk about access. How do we how do we expand access? This one's a no brainer for me. And of course, there's things that need to be done in person.
Right. It
And
doesn't take
that's a
away
big
from that.
no, I don't. I want to try to get away from this protectionist mindset and just kind of like, guys, there's 52% of pets in the US that are getting no care.
Yeah.
And so there's so much, we have an abundance of pets. We don't have enough veterinarians. This is a way. And a lot of the time, the pets that I see on the platform, the pet parents, they're not choosing between, do I go in person or do I do telemedicine? They're choosing between, do I do telemedicine or nothing at
Or
all?
nothing. Yeah. I think that's what
Mm-hmm.
we forget when we're having this discussion is the doctors that own practices or the corporations are trying to protect their businesses by not having a bunch of people on telemedicine and also the concerns about your licensing. Because I know during COVID, I did telemedicine and it was far from ideal. And as I was doing it, there were days I was like, oh, I hope this doesn't get me into trouble. Like you're looking at skin conditions over the phone and you're trying to guess what's wrong with them and, give them the right shampoo or the right, or how do we do a test on this pet? And so I think that, kind of figuring out a way to make that so veterinarians aren't afraid of that. Like, what's going to happen to my
Mm-hmm.
license if I do a telemedicine appointment and something goes awry, or I don't make the right call because I can't see the growth that the person's showing me, or whatever. I think that was a big fear that I had during COVID, to the point I even remember, and I probably shouldn't say this out loud, but I'm not in my hospital anymore, so I'm probably safe. But I was on vacation one time and I was literally doing telemedicine for my practice while I was on vacation. And we were telling all the clients that was happening. My techs were bringing the pet into the building and talking to me over telemedicine. What should we do? What blood work should we draw? Like I was instructing my own staff, but we were so
Yeah.
short-handed with veterinarians, and we couldn't take care of all the people during COVID. And so, and I was going to Florida, and I'm like, well, the only thing I can offer is I'll see some patients on telemedicine so we can kind of try to keep the place going so people can get paid. And so there were a few times when I was like, well, take an x-ray and then send me the x-ray and I'll look at it, and see what I think is wrong with the pet. It was a little bit, it felt a little sketchy to me, but I want to learn how we can make that work.
So you're not the only one, and I don't think you should feel sketchy about that all at all.
It
So
was
I have,
scary at the time though,
because it's
because it
new,
was so
right?
new. Yeah, it was like,
Good
oh,
for
is this going to get me
you.
in trouble?
Yeah, but think about it. Would those pets have gotten care had you not helped them? Maybe not,
No.
right?
No, they
There
absolutely
is,
wouldn't have because there was too
yeah.
many patients right then during COVID. Like we were just flooded and we just didn't have enough doctors.
You know, Julie, I'm going to send you a book by a friend, Dr. Krista Wallace. She wrote Beyond Clinic Walls is the name of it. And I picked up
Okay.
her book. She's a veterinarian. She's in Kansas. And she did just what you're talking about there. She had her own practice. And she also liked to go travel. And she would do that very thing and see patients. She even teched it up where she had a stethoscope attachment so that she could see like an ECG from her phone sitting on the beach
Nice.
in Florida, and her
Wow.
techs were listening to a pet in her clinic.
That's
And a lot
awesome.
of the time is like, okay, a pet comes in like it's a UTI presentation, but this is the second, maybe third one in a shorter period of time. Go take an x-ray. That makes a huge difference. You find a
Sure.
stone in a cat, and you can
Yeah.
you can treat that virtually. And I do know a larger corporate group that is using telemedicine to be able to serve clients and to solve this access to care issue. And when we don't have enough veterinarians, we got to get creative,
Sure.
right? Just doing things the way that we always have doesn't solve. So I'm like, you should be proud that you
Well, I,
that
I
you're doing
felt
that
good
too.
about it at the time, but I also felt a little bit weird because I was like, well, what if something happens while the pet's in the hospital and I'm not there? And, because there were
Yeah.
times when there was no doctor in the hospital, which felt really
Hmm.
sketchy to me. But
Hmm.
we were just totally honest with the clients and we said, look,
Yes.
we can do certain things by telemedicine, and Dr. Capel will be there virtually, but she's not going to be in the building. And so if you need something, we can help you, but with that understanding, so it was
Right.
full disclosure that if something happens, you might have to go to the ER, which at that time the ER waits were like 7 or 8 hours. It was insane. So
Yeah.
that was one of the reasons that we kind of did it. But so I love the idea, but I also see the debate, in
Hmm.
vet med, and it kind of concerns me because some people are so passionately voting against it. Um,
We should talk about that for we should give that some time and some space,
yeah,
because I
let's do
think
that.
it's right to do that, because if we're the world that I see is where telemedicine complements, not competes with in-person care, and we decide, as a group, okay, these are the types of things that we treat through telemedicine, and these are the things that we don't, and we clearly communicate that with pet
Sure.
parents, and we build the infrastructure around it so that if you're gone, that pet parent has an ER to go to right
Right.
away if there was an emergency.
Right.
And that, and there's right now there's definitely a trade organization that is opposing telemedicine and telemedicine regulations. When you were talking about you were nervous, nervous about a complaint, I hear that from veterinarians. But the thing is, and maybe this is my next op-ed. So
You
your
said you're
listeners
working
get,
on one.
yeah, your listeners get like a little bit of a sneak peek as we think about these types of regulations. What comes to my mind, and what what I can't stop thinking about feels like the most egregious thing that's happened to veterinarians in our lifetime is this idea that our judgment doesn't count, right? Like the veterinarian, you use your judgment and you practice shared decision making with clients with open conversations. But if we just go around saying restrictions or you can't do this, like nowhere in our practice acts does it say that you have to use a stethoscope to listen to the heart or that you have to do a rectal on every pet. But if we go around saying you can do telemedicine here, but you can't do it here, it's like, well, do the doctors in those states have better judgment?
Right.
Why don't we say, hey, the veterinarians should be the ones that are using their judgment to decide when this is an appropriate tool and they have enough knowledge? Because to me, proximity doesn't equal knowledge. And
Sure.
if we undermine veterinarians and say, we don't trust you to do this here to make that right judgment call, then, why are we licensing them and investing in training them? So it just kind of, it doesn't make sense to me. Um, and I don't think it makes sense to a lot of courts as well, as was recently showed in the Fifth Circuit in Texas. There was a case that was brought before the Fifth Circuit Court there, where the judge said, hey, I don't understand why this is okay. His words were, I don't understand why this is okay for Uncle Bernard, but not for my Saint Bernard. So,
Oh, nice. That's true. It's true because we do
yeah,
telemedicine, right?
yeah, I was just at my doctor's office and like they had the intake, their schedule and their telemedicine was one of the call-ins, just like
Mhm.
no big deal as part of their workflow.
Yep.
And so why do we do this so regularly for people, but not for pets? I mean, I think if you follow the money, questions start to get answered there. Veterinarians are smart and we can figure that out. But
Sure.
I think rather than restricting and undermining veterinarians' judgment, the future that I see is where we come to kind of an agreement around, okay, we trust veterinarians to use their judgment to know when they have sufficient knowledge to establish that veterinarian client patient relationship.
Well,
Um,
and that's kind of how it is in all circumstances. Like before, we had a lot of the ERs and the specialists and things like that. As veterinarians, we just had to make our best call and
yeah,
do our best and tell the client, look, I haven't done this surgery before, but this is what I think needs to be done, and there's nowhere else to do it. And so we have to decide, do you want me to
and you use your
try?
training.
Yeah, do you want me to try my best and do the best I can and then, hope for the best? Or do we want to not do that and hope the pet lives without the surgery or whatever? Like we did that all the
Yeah,
time. And you did that
yeah,
as an equine vet too, right? Like you can't just run out to every farm and, fix broken legs or cut things. You just have to try what works best. And so I think the fact that we've gotten so litigious, feared, because I don't think people sue us as much as we fear that they're going to. And then the board complaint fear and the bad review on Google fear, like that is stifling our ability to be creative and help people in a way that they need help. And that's one of the disturbing trends that I see is the younger veterinarians fear to try
mm-hmm.
something new or I've never done this before. I have to
Yeah,
refer it. Everybody wants to refer everything. And at some point you run out of specialists. You can't refer everything. So I kind of think that overarching fear is affecting our profession in a bad way.
I completely agree with you there. I mean, like we veterinarians, we do so much training, and we should be using it. And I think it's also rewarding to us as vets to get to practice what we learn, to get to
Sure.
try new things and to feel really good about it, to do a surgery that was new, and pushes you a little bit. I think that that's a really rewarding part of the profession to help keep vets in the profession to be able to do that. So I'm with you, and not all pet parents these days, like the cost of care keeps coming up. Like they can't always afford to go to the top specialists. So being able to do something like that is, I think, is really good. And I mean, this actually brought up in my mind the topic of trust too, like trusting our veterinarians. I've seen an evolution of like the James Harriet days, where the veterinarian's like this most trusted person in the
Yeah,
community. And when costs of care get so expensive, I think that starts to erode pet parents' trust
sure
because
it
they get a
does.
little wary. And I
Yeah,
think that when trade organizations come around and say, you can't, we don't trust you to use your, knowledge online. It's like, wait a second, but I was just practicing inside of a clinic yesterday, but now I'm
right.
online and my judgment doesn't count. I don't think that that portrays this image that we trust veterinarians. And I think that's harmful to the profession,
Sure.
actually. And I don't think that it's as different as, I don't think practicing telemedicine is as different as a lot of veterinarians that are in person think. Like, I use the example of, like, you have, okay, set the scene. You say you are, you've got a 5-year old Frenchie on your schedule for an ear infection, and they come in, and this ear, look, you can like kind of smell it, but the warning pops up in the EMR that they're extremely aggressive. What do you, okay, so this is, you've got an aggressive
You're not gonna
Frenchie.
get an otoscope in that ear. You're just
No, you're
not.
not going to be, you might not even be able to get close to that animal. You might be in
Yeah.
the exam room with them. So what do you do from there? I might actually write a plan for general anesthesia to be able to look in that ear so that I can protect the airway
Sure.
while, we look in there. But if the owner says, oh, no, no, I can't afford to do that because that's pretty expensive,
Or they're afraid to do it. They might be
or
afraid
they're
to put
afraid.
their pet under because some people are. They're deathly afraid of putting their pet under.
Yeah. Yeah. So then what do you do in that scenario? Do you do nothing? No. And that was actually also in the PetSmart Charities report. It was 92% of veterinarians uh, offer something, even if it's not ideal when the pet is
Hmm.
in front of them. So
Mhm.
that is actually, to me, that's like, so veterinarians' behavior is that they understand contextualized care, spectrum of
Right.
care, and we want to help. That
Sure.
totally aligns. But this argument of, okay, you might uh, write a general anesthesia plan for an aggressive Frenchie, but have you established this veterinarian client patient relationship the way that, we know it, that it's written?
Right.
I think that, so to me, that answer is no. But we trust the veterinarian's judgment because they're in proximity with the pet. I just think that we should do that same service for veterinarians to expand access of care when we're virtual as well.
Right.
Yeah.
Well, and we know working in veterinary hospitals, the doctors, like my time with the patients is often very brief because the
Mm-hmm.
techs get the history, the techs do all the, TPR, the techs, do all the things, and then we just do our exam and then we go on and tell the techs what to do, for the most part. So most of that stuff that we do, other than putting our actual hands on the patient, it can be done with telemedicine.
Yeah, it's true. A lot of what we do is that history, understanding a history. And I mean, I don't want to say that I don't. I think the physical exam is a really important part of what we do in veterinary medicine. Um, but when we're talking about access to care and a lot of people, being able to afford care, and yeah, I just had a client the other day. He was in a wheelchair, couldn't get to the veterinary clinic. I had an English bulldog that was over 80 pounds it was limping. They're like, I cannot lift my dog into the car to get, so, and
Right.
that emotional toll that they're feeling because they feel like they can't provide for their loved ones.
Sure.
It's just, so it's very
Something you
rewarding
can
to be able to
solve.
help them. I'm like, I can help
Yeah.
you with that. Like, let me
Right.
get you some Rimadyl.
Right. Yeah. And then if the pet
Yeah.
doesn't get better, we're going to have to figure out a way to get it in for x-rays or like we
And
do that
just,
all the time at our hospitals. Clients call us all the time. Can you just give me some pain meds, doc? Well, sure, I can do that for a couple of days, but if
mhm.
that doesn't work, then you got to come in. And, like we do that all the time and we don't think twice about it, but we
Yeah.
do for some reason push back against telemedicine. Well, this is a really fun discussion, and we could probably go on for several hours, but is there any like one thing that we haven't said that you would like said? And we can always come back and do this again if you're interested and people like this discussion, because I think this is really important to our
Yeah,
profession. It's a big problem that we haven't solved that we need to start to think about solving.
I think, we covered so much ground.
It goes by too fast. I
It
always
went
think
by
these
so
podcasts
fast.
should be 3 or 4 hours and then we could cover everything.
Yeah. I think, I want to empower veterinarians to do this like outside of the box thinking and just give telemedicine a try. Because it's so rewarding and this, recognizing that there's 52% of pets that are getting no care. And so just keeping up with the status quo doesn't serve anybody. Um,
Right.
and yeah, let's work together. I really want to see from the inside out, we can create what the future of veterinary medicine looks like. And let's
Yeah.
do it.
We keep talking about getting more people in the profession, but if we did telemedicine, that could just be like an adjunct.
Mm-hmm.
Do the telemedicine, weed out the ones that you can weed out, and then send the other ones to the in-person
Yeah.
clinic as needed, or to the specialist as needed, or to the ER as needed. It would take a big chunk of the stress off of the in-person hospitals, I think.
And also, I think help keep veterinarians in the profession. Something that's been very rewarding for me
Yes.
has been when vets tell me they were gonna burn out and leave the profession altogether, but then they started doing telemedicine where they
And
could
they
do it.
liked it.
Yeah, they liked it. So my heart is warmed at the idea of instead of leaving this profession that they love, that they invested so much in, those vets can find us and do telemedicine and continue doing this thing that they love, and then maybe come back and do a balance of doing some stuff in person and telemedicine too. So
I
that's
love
been,
that.
yeah, I think that there's like it supports the veterinary profession in these different ways, reducing burnout and then the workflow when, there's a lost opportunity cost for seeing pets in the clinic in person when they don't actually need to be there. And it's a
Right.
total stress on them.
Sure.
So, yeah,
Yeah, I love that. Well, tell people where they can find out more about Dutch, find out more about you. If they have any questions, they can either email me or if you want to
yeah,
give out a place where they can contact you, um, where can they find out
absolutely.
more?
You can always email me I'm going to give out my personal work email here, Dr. Kate at Dutch.com. So it's dr.kate at Dutch.com. And you can find out more about Dutch at Dutch.com. We are a telemedicine platform where we see pets in all 50 states across the US. And it's a very affordable way for pet parents to get care, $11 a month, and they can have up to 5 pets on their platform. And yeah, we love what we're doing. We are a pets first organization. So when it comes to decision making time, this is another thing that I love about our group and everybody that works with us is always our lighthouse is what's best for the pets. So it's a really fun place to be.
I love that. Well, I'm so happy that you're happy in vet med and that you can share that happiness with all of the veterinarians and people that work in vet med that listen, because that's what I think it's really all about is making this profession better for us and also for the pet owning public, and because that's what we're all about. So anything that we can do to make that better, I think is amazing. So it's been super fun meeting you and talking to you. And at some point, maybe we'll do it again after you write your next op-ed, maybe we'll
That
see
sounds
how
great.
it
Here's
goes
the date
over.
with
And
the
then
teaser. Yeah.
yeah, and then you can come back and talk about it. So that'd be
I
great.
would love that. I would love that. Thank you so much for having me on your podcast. I really appreciate it.
That's great. All right, everybody, thanks for listening and have a beautiful week. Bye. Bye, Kate.